Yeah, please. Thank you. CEOs, sorry, hit my legal. I am delighted to be here. I'm Carol Westlake. I am the director of the Tennessee Disability Coalition. We have been working on Medicaid expansion with the healthcare campaign and others for a really long time. And one of the people who we worked on that with is Emanuelson. So although Abby is from North Carolina, for a long time, she worked with the MS Society, multiple sclerosis, and worked with the Nashville, Tennessee chapter on Insure Tennessee. And, you know, when that wasn't successful, apparently she went to North Carolina and made it happen. So now she's going to come back and tell us how it's done. Anyway, if you want to read her bio, you know, you've got that little QR code and it is available online. But she has been with Care for Carolina almost since the beginning of their efforts in 2020, 2021.
The campaign just started in 2014.
2014. Whoa. Okay. So, oh, good. I don't feel so bad. You know, like 2 years, get it done. We've only been at it for maybe 12, right? So at any rate, we are delighted to have her. The objectives today are to really learn about the process that North Carolina undertook to get health advocates advancing Medicaid expansion. Talk a little bit about, I think she's going to talk a little bit about the key players who were involved in that, partnerships, milestones that created some success. And hopefully we can learn a little bit about both the challenges and the opportunities that'll move us toward winning Medicaid expansion in Tennessee. So thank you for being with us. Silent cell phones. We'll try to keep about 10 minutes at the end for questions or more. I am going to see if I can figure out how to change the slides. Or does somebody else do that? Here we go. I'm going to get there. Everyone be patient with me. I know we had this open, didn't we?
But we've known Carol for years, and so if she can get us there, she is really.
There you go. And I will let you think through your own slides. Thank you. Abby.
I know when I found out that Carol was moderating, I was like, well, why do I need to be here? She's the queen of coalition work. So thank you so much for having me. And like Carol said, I know what y'all have been through. We've been through it in North Carolina. A lot of our colleagues in the Southeast are still going through it. So I'm just glad that people are still talking about it. And that's why I'm here today. And I hope that we can give you some hope in from North Carolina and help with your momentum. I just highlight just who I am, which we've heard, but joining me, I am the incoming executive director of Care for Carolina. We just lost our current executive director on the left, Erica Palmer-Smith, to one of our coalition partners, NC Child, she was also going to plan to join us, but starts her new job on Monday. So, but I'm excited to be here and represent Care for Carolina. Care for Carolina started in 2014, mostly to find a North Carolina solution to closing the coverage gap. We made it very North Carolina specific and left out Medicaid expansion so that people would not feel as divisive about it. Our 501c3 status is through a fiduciary agent, fiscal agent, which means that we have to fall under their lobbying laws, and through their charitable donations. So donations to Care for Carolina are tax deductible, but they are set through the fiduciary agent. It took us, as you can see, from 2014 to 2017 to start organizing enough to have an executive director. We have a very active coalition chair, Peg O'Connell, who was a contract lobbyist and in insurance and in child and family and issues that she's really strong coalition chair. She's hit retirement, but she's committed to staying a part of this work until it's done. We also have a very strong steering committee, 10 to 12 members that are part of the founding coalition, as well as the people that we have brought in to bring in different interests that will help our work. In 2022, we started, as of today, we contract with, and it's floated in and out in different ways, but we have a lobbying firm that we contract with, a communication strategy firm. We have a business and community engagement officer, 2 regional community engagement officers, an admin, an event coordinator, an intern, which has been really the intern program that they've established has carried a lot of work through. And before I became the exec director, I was doing grassroots and advocacy consulting for them. For financial contributions, we gather really good financial support from state and regional foundations. Our stakeholders have been key in providing funds for us, as well as some philanthropic organizations that really focus on trying to get Medicaid expansion passed in North Carolina and some other states, and individual donors. So I'll start off with the reason why we really felt like we had to organize. And it's for our Senate President Pro Tem, Phil Berger. He, the stalwart of the Senate, from the conservative side, 20+ years in the Senate, 10+ years as the Pro Tem. He's from a primarily rural district. It's on the Virginia, North Carolina line, just north of Greensboro and Winston-Salem, kind of along there. And you couldn't really tell like what his interests are. I mean, he's an attorney, husband and father, but and I put this quote because it's kind of what galvanized us all. Please help me stop Obamacare in North Carolina. That's what he said in 2013 as he was introducing legislation to keep North Carolina from expanding Medicaid or having a health benefits exchange. So really the coalition has come in to convince Phil Berger that this is the right thing to do. It was long coming, but it's happening. So just to show just many of the groups that are here that you represent in Tennessee, we're part of our coalition that's founded Care for Carolina, the North Carolina Justice Center, American Cancer Society, the American Heart Association, March of Dimes, and the Public Health Association. American Heart really took the lead on this work for us, became the first fiscal agent, and helped us be able to afford to have our first executive director because of their commitment. And I'm sorry, it's like year by year, but I think each year that we grew, it helped push us to that next area where we started building the coalition. So in those 2015 and 2016 years, it was very soft opening. We would just invite people that we knew that had been working on the issue, and then call it together. And we really focused on the community foundations, the hospitals and the hospital systems, rural health groups, the rural health center, the rural center, and family and children organizations, people that maybe not have time dedicated solely to Medicaid expansion, but had an interest, knew that we were really wanting to get together. And it was very informal for those first 3 years, because nobody really wanted to put themselves out there as we were forming this coalition. But they said, well, we need to be straight about membership, and we need to really decide who's going to be a part of this organization. And so we established bylaws. The lawyers in the group are probably wondering why we waited so long, but that's the reason. We started collecting those financial contributions, and we knew that we needed to get into rural North Carolina, and we held our first summit on closing the health insurance coverage gap. And we were, again, the groups that were a part of our work, like the Cancer Society, brought in their national experts on Medicaid. We brought in the Rural Health Center, talking about the economic benefits, the health benefits of closing the coverage gap and expanding Medicaid. Also in 2016, as things were moving along, before I move on to 2016, it was election year. We knew by the end of 2016, there was suspicion that we would have a Democratic governor. We also were hopeful that we were going to keep a Democratic administration. So the pressure of a Democratic administration and Democratic governor would help us push the Republican legislature to move forward. And then we all know what happened in 2016. But we did get a Democratic governor. And to support having a Democratic governor, we started doing these we took the health summit that we had in 2016 and really took them to rural communities across the state. We got our opinion, as was suggested earlier today, we wrote op-eds from key leaders in the community. We held a prayer breakfast. And some of these members really started to emerge as champions. We had 4 House members that were hospital administrator, a county commissioner, surgeon, and a Republican registered nurse. Having those medical professionals that would come out in support of expansion, really in closing the coverage gap, really helped motivate the coalition. I'll explain later why I note the budget veto. There was still a super majority in the North Carolina legislature of House members and Senate members. So when the governor vetoed the budget because it did not include Medicaid expansion, it was immediately overridden. Also, to the advantage of our work that what helped later is that Virginia passed expansion in 2018 and started enrolling in early 2019. So having that pressure from our bordering state helped significantly. And as we started counting membership, we baselined it at 40 members. Just an example of our healthcare forum invitees. We had the hospital representatives, the community health centers, county commissioners, law enforcement. That's where the discussion of mental health and the cost of the mental health that the sheriffs were experiencing, the crisis that people were in and how it was impacting law enforcement. Also, we were hearing in these meetings about the cost of incarceration in these counties that the counties are having to pay for medical care. So that came up as a part of our work. And then if there were local businesses and industry and legislators, we invited them to attend and kind of have that time together.
We can only see your eyes, Lisa.
So sorry.
So you're not tall enough. Does anybody know how to do this?
I'll step.
I don't know.
Okay. You're getting good.
This slide's back.
Okay.
Stay there. Okay.
Let's see. Actually.
Okay, yeah.
Yeah, that do it?
Right.
Oh, good. No, thank you. Because of the rural forums that we were having, we identified a farmer that when the champions decided to introduce legislation, he spoke at the press conference and really brought home that story of rural communities and how Medicaid expansion could help. I mean, of course, we heard earlier about the rural hospitals. We brought that message in quite a bit. And then we were also bringing in the mental health care, how it would benefit North Carolina if we expanded. We held our prayer breakfast. I include this picture because it's come back to haunt me, because as we've continued to do prayer breakfast, we never have quite got this money shot of people actually praying. So if you hold a prayer breakfast, make sure the cameraman is gone. He needs to make sure that he gets people bowing their heads if you hold that. So it was captured by the journalist that attended, and she came back this year. She's like, "Where are they praying?" I was like, "I have not got it." She even sent this to me. She was like, "Why aren't they doing?" So 2019 really was a banner year for us. We had at the beginning of 2019, some of our coalition partners had gathered some money around to go to and asked conservative pollsters to poll on Medicaid expansion. And they polled that North Carolina Republicans were favorable to Medicaid expansion. So that was enough to start, again, having this conversation with legislators. We really worked our capacity grants, started increasing grants that were $30,000 or $40,000 a year, doubled or tripled. So that was significant enough that we could hire our full-time executive director. And then on top of that, they partnered together to produce this document, which is the economic and employment benefits on expanding Medicaid in North Carolina, which really highlighted workers in the communities that could really focus on in the economic impact in each of these communities that were really significant to go to legislators with, and tell members of our coalition, like, this is when you go and talk to build up community capacity, here's how it's impacting your work. Also in 2019, we did get reintroduction of legislation and did pass the health committee. The governor, our fiscal year is July 1. They passed the budget sometime in July probably, and the governor vetoed the budget. And because they had lost the supermajority in 2018, his veto was sustained. And that was all because, one of the major reasons was because Medicaid expansion was not included in it. And this was kind of the start of, like, he's going to have to work with the governor on this work, and to support that work and all the research that was going on for the coalition is we started doing a blog series. To kind of promote all the research that was being done, put a personal spin on it. Our coalition chair, Peg, is a prolific writer. She would write blogs that we could push out. Still, stakeholders were still few and far between. We added a few that year, but not as significant as 2020 when everybody was very buoyed by the veto being sustained. The governor called Care for Carolina in to keep the support up. And so we, as a coalition, held through all of our community work, pulled our conservative county commissioners in, the sheriff and a veteran and business leaders, and across from the state capitol held a press conference calling for expansion legislation to either be included in the budget and pass the budget, or pass the legislation. Also in 2020, everybody knows about the pandemic, but this was really a buoyed part of our work that that allowed us to really get to the stakeholders that we were meeting in the community that couldn't drive 2 to 3 hours to Raleigh. So we saw a really big pickup of participation among stakeholders, thanks to the virtual platform. We'd have monthly meetings of our stakeholders, and then we were going in and also having regional meetings. Thanks to the business and community leader officer that we had hired, we launched a business advisory council that really motivated business leaders, talk to business leaders to really hone in on the business communications to connect other businesses to the work. Working with our partners, we went into 2020 polling in very key Republican districts of people that we knew were not the speaker or the president pro tem of the Senate, but hit a lot of people that supported him, like the healthcare committee chairs. We went to those districts and polled Medicaid expansion, and having those results in those districts really made a huge difference in gaining support of certain members of the legislature. The other piece that we did, because of being more virtual, is that we needed to keep creating content for our website and our social media. And so we started a fact of the week that we shared. Also, at this time, we were really seeing significant funding increases among the foundations. We actually quintupled. And then our stakeholders from 2015, 2016 doubled to 80, had doubled. Just for just example of the work that we did. So that this is our virtual briefing. Looks like all the other virtual meetings I know, but we really tried to tie in the COVID-19 impact and the health insurance coverage gap, tying that in, taking that to different communities. We still held the virtual meetings in small regional groups, even though they could be accessed by everybody, but we kept them in regions. And then when we held our business advisory council pieces, we really focused in on that economic impact work. Here's an example of our fact of the week. Really, we branded in the orange and blue examples, and that was really a suggestion from our friends in Virginia, which said that if we could be unbranded material was really worked for Virginia. So to keep things kind of neutral in that work, even though we had so many coalition partners as part of this, we did try to keep things neutral. All of our facts are based out of a resource that we can do, and we kept on focusing on the business aspect, the veteran aspect, the role aspect. So we were like, those key pieces that we thought conservative messaging would help with. And then this private health insurance rates going down in expansion states, we've carried that through as well. Just knowing that the premium reductions for average North Carolinians have gone down has been a piece that we've carried through for the last couple of years in our work. So in 2021, we'd had all of this work going on. We had a lot of grassroots work, but we needed more at the legislature. And so we really solicited unrestricted donations so that we could increase our lobbying efforts. And so strategically hired key lobbyists with relationships to members of the House and then separately members of the Senate, so that we could start convincing lawmakers to start considering the legislation. We launched the Faith Advisory Council. We had so many folks involved with the prayer breakfast, so we just went ahead and started really focusing on the Faith Advisory Council. There's a lot of good work on the faith community and expansion and tying those in. We're happy to provide that work of linking where in religious studies and serving individuals works together. We have that. I think I saw that Kansas also did some work there. So if that's something that y'all want to work with, we're happy to provide it. Along with all of our resources, which are on our website, you can feel free to use. We got 300 business leaders through that work to endorse Care for Carolina. We made sure that they were in every 100 counties. Primarily, they ended up in our more urban areas, but we did cover every county. We really, we were fortunate enough to have a regional foundation reach out to us and say that we want to come and focus on Western North Carolina. We will provide you money to do an education campaign, no lobbying, but key regional work. And this really became a foundation of our work, which I'll share in just a second with some more video, with more pictures. But also once the American Rescue Plan was passed, we leveraged that so that we could explain exactly how many dollars were going to come to North Carolina through ARP funding, through that 5% increase in traditional Medicaid bump, as well as the additional, that 10% increase. So all of that, counting that, explaining the economic benefits per county to each of these regions was part of those forums. We also created a North Carolina coverage gap county impact map, which I'll share with you. We had done so well with our blogging and our fact of the week that we started linking that work so that every fact of the week had a supporting blog to explain why that fact was so important. Because also that the work, we knew that our members of the legislature were so interested in having a workforce, a work requirement. And with the administration, the Biden administration, in the courts nixing work requirements, we started focusing on workforce development. There is a plan in Montana that really focused on workforce development, and we were able to link some key industry that gained employment because of workforce development initiatives through expansion and having those additional dollars. Some of them are really key, that especially during the pandemic, where you could talk about how important they are. Truck driving, like getting somebody their CDL license, it seems was part of the workforce development that Montana highlighted. We have highlighted it across North Carolina and legislative offices because that's a huge area where we need employment. In our healthcare industry, or some of them are the they needs more work development there with that underserved. So we really have changed that conversation to workforce development. We thought, okay, the governor, he's got it. We've talked about Medicaid expansion. We're having some positive thoughts. He's going to veto the budget again because it doesn't include Medicaid expansion. But there was because of 2 years, almost 2.5, almost 3 years of not having a budget, there was so much money in our state legislature. I know it sounds so pitiful, right? But we had so much money that he couldn't not sign the budget because there was so much money federally that had come down that they needed to distribute. So they worked out a deal to have language in the budget that for a legislative study committee on health access and Medicaid expansion. The best part about this is that it included the word Medicaid expansion so that we could say Medicaid expansion at the North Carolina General Assembly and not always use close the coverage gap. I mean, everybody knew what we were talking about, but we couldn't say it. And now we say it proudly. And, thanks to all of the outreach, we now, at the end of 2021, we had 125 organizations. So the success we were building, the work that we were doing in the public eye was really bringing in more members, key organizational members to that work. And part of these business leaders, and I talked about this a little bit during lunch, said some of these leaders that we had were our Medicaid managed care organizations, that they came in and supported Care for Carolina. You're late on North Carolina's late on the Medicaid managed care plan work. They didn't actually start until 2020 because we had just been a PPO state Medicaid plan. So it was new. This is how the Medicaid transformation was how the Republican majority was going to fix the whole system. And we said, okay, you fixed the whole system. Now can we expand Medicaid? And the NCOs have come in to say, yes, we really need that much for right now as we get to the end of the pandemic and the health emergency. They see the redetermination issues right on the wall. And so they need to, they want to make sure that we have Medicaid so those folks don't fall into a further gap of not having health insurance after already having it. At the beginning of 2021, I found this article, like all the plus signs of all the great things. We're going to get more jobs and more tax dollars, and we're going to save lives. And Senator Berger still saying bad for policy. But thanks to that Western regional money in that education, we held this forum with our partners, the Rural Center, and had really great forum. And one of the people that spoke up first and foremost was Senator Kevin Corbin. He's on our furthest west district. So if you guys need to pull him over, I'm sure he would come. But he's a former insurance agent, and so he was, having people that couldn't afford health insurance. And so it really touched his heart. And he was one of the first, and he is a former House member that moved to the Senate. So he has relationships on the House side and relationships and starting to build these relationships on the Senate side. He got elected to the Senate supporting Medicaid expansion. And he was one of those unicorns that said, I am a Republican that still got elected because I supported Medicaid expansion. And so that has been a message too that we've kind of been sharing with Republican leadership, that you can support this and still win. Here's our example of our county map. If anybody wants to see them up close and personal, they're on our website, but they really highlight the number of uninsured, the percentage of uninsured between 18 and 64. We talk about how many jobs it's bringing to the county. We talk about the number of how much county revenue you're going to get, how much business activity it is. And then we price out really the premiums, because some people, like legislators especially, but other people don't know what the cost of the premium is and why they don't qualify for the subsidy. So we just try to break that down county by county. And some of this is all insurance knowledge that people all probably know intuitively, but like if it was in a major metropolitan area, the percentage of uninsured were down, the premiums were lower. But then if you're talking about the far east and the far west of our state, those numbers were much higher. And we also pulled out, really highlighting the opioid deaths and the cost for incarceration by county. In this way, we could bring this to, Tennessee did this, and Insurance Tennessee, they did it by Senate districts. Our districts have been changing so much over the last 12 years. We just had to do it by county. Numbers were pretty easy. And so every district we just bring in, when we go to talk to lawmakers, we bring in each county specific work that they represent. With that regional dollars that we got in the West, we did a huge educational campaign focusing on workers and health outcomes, and shared those stories on our YouTube channel. You can see some of the work that we did. We also had a veterans ad that just talked about, if you want to get more involved in our campaign in the West, you can contact us. There was no advocacy activity. It was all education based. There was no action alert to contact their legislator. It was get them more involved. And so Brittany's story, her father died of liver cancer without health insurance and worked in Western North Carolina. And it's a powerful story. She told it in her own words, in her own voice. She sounds like Western North Carolina, and it really was impactful. Also, as a part of the Western work, the Eastern Band of Cherokee, who owns the hospital right there, the Cherokee Hospital, really, their CEO of the hospital started going to county commissioners off and telling the story of importance of expansion and the mental health crisis in the Native American community. And he went to county commissioner office, several county commissioner offices, and went to their meetings. And we had, I think, 5 or 6 county commission in that region support Medicaid expansion and support closing the coverage gap. And that I was talking to our health department of HHS secretary, assistant secretary, on the way here yesterday, and he said that was the most significant part of the campaign that helped the governor the most, when we had county commissioners come in and pass resolutions to support the work. And that was all done by the coalition, really working in building up the community support. Just an example of our regional forum, again, and pulling everybody together, as well as our blog post. And I put this in there because we had made so much work, and this really because all of you know this, that when they worked so hard, and the momentum is so disheartening after, again, you don't pass Medicaid expansion, that people really needed to feel supported by the work. And so Governor Cooper and Secretary Cohen came in, spoke to us regionally and shared their support. And it was a big part of kind of bringing the coalition back together. They all wanted the governor to know that they've been part of Medicaid expansion, and it kept them all together. So if there is a champion that you can highlight to just kind of make sure to check in with your coalition members, that really has proven helpful. So now we get to 2022. We thought we were going to have it done in 2021, just like we thought in 2019, but semantics. But we really got into a funding crisis at the beginning of 2022 because of the need to continue lobbying. We had plenty of coalition work and funding to keep it, but we needed unrestricted dollars. So we did go full force on trying to secure unrestricted funding. The op-eds work, and as soon as you can bring a message of the conservative voices, which we recycled, the veterans, the cost of insurance going down, healthcare workers in the gap. We just continued to highlight that this past year with op-eds. We really, this year, because so many fast-moving pieces, we really had to have all of our lobbyists and member organizations share intelligence on what was going on at the legislature. This was happening as part of the coalition stakeholder monthly meetings, but also in private, like weekly meetings, so that we can keep up. We also, at the beginning of 2022, there was because as a part of the budget, that committee that came through, we had the beginning of 2022 was the study committee where they talked about expansion and these extraneous other issues like certificate of need. That really turned into it was a part where everybody was finally coming back to the legislature and coming together and really starting to talk about this issue. One of the things that helped, we had Montana come in, talk about workforce development, but we also had Governor Kasich come in from Ohio and share why Ohio did this. And he kind of pushed the legislators a little bit and said, you know, if Ohio wants to compete with if North Carolina wants to compete with Ohio, we're going to come after your jobs. If so, you need to pass expansion. And so it was, and then also ties it into, we have like, and probably many of you have heard this talk about, you know, St. Peter's not, he tells his story about St. Peter's not going to judge him on how many budgets he balanced, but it's going to be, he feels that St. Peter is going to judge him on helping the least of these. And I mean, there were several of us in the Medicaid expansion world that just wanted to rise up and clap hands and shout out amen. But he, but it did not happen. But he has been, that work was the highlight of all of the media. And we were able to, again, push that work. And the North Carolina Senate did come in and pass legislation, and I'll share what was said there. We had our in-person prayer breakfast, and we focused on veteran health. We brought in the executive director of chaplains, former executive director of chaplains, to come in and speak and share his story of expansion and how important it is. The North Carolina House, again, passed study legislation. But because of all the work that we had done with those Western counties and some work from others, we did get the North Carolina County Commissioners Association, as well as the Sheriff's Association to support and endorse expansion. And then we also had done some work with Chambers of Commerce and got them to their endorsement. So here's where the hope comes in. So this Senator Berger, when he released his the legislation to expand Medicaid, one of the things that he said was, if there's a person in North Carolina who has spoken out against Medicaid expansion more than I have, I'd like to meet that person. There is no other person. He was it. And then he's talked about why his views have changed and why this was the right time and right thing to do. These are all quotes that I hope that y'all can get your leadership to say too. And so I put them out there so you have something to strive to. We need coverage for the working poor. The Affordable Care Act is not going away. All legal and legislative attempts have not succeeded, and I don't think that's going to change. And I mean, I told you in the beginning, he's the stalwart Republican of North Carolina, the Republican leader. He told everybody the 90% reimbursement will continue. Called it good state fiscal policy. The case which he talks about a young single mother who was working full-time and that children, that was a story that my colleague Erica Palmer told numerous times, and as well as Senator Corbin. So to hear it out of his mouth was, I actually saw some tears in some of the people that had shared this work. And so it was just really kind of amazing to hear that. I hope that, again, you can get your leaders to start saying this well. But again, you saw how long it took. Not to be outdone, when Senator Berger, not only did he say that in the press conference, he, as the leader, he never speaks on the Senate floor. He shared all of that on the Senate floor. So that was also kind of the amazement of that work. So not to be outdone, the House Speaker who was pushed into a corner. And so he also had to come out and say that he would consider expansion. And he, again, he followed up with the language about these federal funds are going to be there. They're funds that are going to other states and not coming here, not letting the feds take over and create a plan that North Carolina can work on. So these were all messages that we had shared that they started repeating. So as of today, we both bills are still pending. The 2022 budget passed and signed by the governor with the promise of a Medicaid expansion bill as a part of the adjournment resolution for the state, we had, they put in 2 days per month. That's calendared for for each month for the rest of the duration of the year. This is in hopes that the hospital association will come to an agreement on certificate of need laws, and that once that deal is made, that they can come in and get this legislation passed. There was also the House also really committed to a December deadline. Of course, information has come out from like everyone, the hospitals are, like every state, hospitals are in a major crunch due to COVID. Labor costs are high. As a part of the compromise legislation, they worked out with North Carolina's governor to get additional funds. I think it's called, they renamed it, it's called Hospital Assessment Program, but it allows them to draw down additional dollars. It's enough, they can draw down enough additional dollars that it will cover the assessment. So they cover the 10%. So that's all worked out. But they haven't quite come to a deal. But when I left yesterday afternoon to come here, they had just dropped off, the hospital association had dropped off their first round of negotiation with the legislature. So might be closer than we think. The number of organizations now at 157. We are continuing to have to raise money in case this gets flipped next year too. And we're continuously trying to add stories to the story bank. That has probably been the hardest part of this coalition work, is that it's such a hard story to tell that people are in the coverage gap, that we just haven't always found the real people to come in that are the people that can share that story and do that. So we're really continuing to make that effort strong. Yeah. I think I did more. Yep. So lessons learned, get a historian, because I had to put all of this work together in the last week and nobody had kept the documentation. So I recommend getting a historian. One of the things that I think national nonprofits are doing, starting to do better on, which I think would have been really good for the coalition, is to secure a relationship management tool like MailChimp, so that they could do better communications other than Gmail. So that has been harder. One of the things that I certainly have thought that we were not as clear as we probably could have been, even in the bylaws, is to find what membership looks like and participant expectations. People could endorse as individuals, but they weren't getting invited to the stakeholder meeting, but if their organization endorsed, they could be, and things weren't really clear. There's no minimum to join. There's nothing required, but I think that if people would have known exactly what was expected of them, we could have done something better. And then from the very beginning, if we would have had more of a coalition bank, story bank to use, would be really strong. And of course, you probably have heard my story now and have heard this. You probably have some other lessons you've learned that I'm willing to put down as I've done this work. There's our website. We're on Facebook, we're on Twitter. We started LinkedIn as we started engaging with the business community, just so that we could tie those business messages on that platform. Some of our Facebook messages move over to Instagram when we promote them, but we've mostly focused on Facebook, and Facebook for general supporters, Twitter for our legislators, and sharing that message, and then again LinkedIn for our business community. And through any of this, you're welcome to reach out to me if I can be of any help. So that's it.
Perfect timing. There's 10 minutes left. Were there any questions online?
So far, none.
Okay, any questions? Oh, we got questions here.
question, but I'll start with you.
Okay.
Is this, with the proposals that are put forward, is the state fully funding the state share? Do you have any other partners?
They have, I'm sorry, who is providing the state share is the question. And it, in all of the proposals, it is it originally has been the hospitals, hospital assessment. There, the MCOs people have thrown out different folks to join in, including the MCOs. I'm not sure. Okay, I can find that out.
Well, and then so the MCO have part of that state share. And then you did mention this organization. Can you tell me a little bit about that? Did they approach you? Did you approach them?
Well,
And again,
the question is, did we approach the MCOs for their support? And the answer is, I think it was mutual. So I think we did reach out to them initially because they were so new to the state that we were reaching out and mostly just trying to get them to be members to learn more about the work. But because their dollars are unrestricted, that has helped us do some of the more lobbying work that we needed to get done and more outreach. And they've been really strong lobbyists so that we've been sharing intelligence on just because of the way that they contract with their work.
And I assume it's Medicaid.
Yes. Jeannie.
I'm wondering if you could give us some tips about how you build that business folder.
So the question is the tips for the Build Business Coalition. We really did leverage some of our partners that actually helped us hire the business and outreach officer. She really went to some key members of the community that she had history with, that she could kind of start talking to. One of those of the business community was our former Secretary of Commerce. And because of relationships with the Secretary of Commerce coming out and support, she was the secretary was really good about going in and having conversations. And when the former Secretary of Commerce comes to a business, they respond a little bit better. Though we really also relied on the Role Center and their work in the business community. Patrick Woody of the North Carolina Role Center is the chair of our Business Advisory Council. And so his involvement really started helping us bring new individuals to that work. So we've just taken one entity and moved on to another entity. We pulled together, just last week, we pulled together some of the business members and to see what other industries were we missing. Well, we had not engaged the banking industry. We hadn't really engaged with food services. So we've just piecemealed but gone in, and then as soon as somebody showed some interest, they looked convinced, or they've been already interested. We really tried to highlight those communities. And one of the North Carolina Eastern Alliance, which is like a regional chamber, one of the members of that, John Chafee came in and joined our coalition, and we made sure that like his business credentials were shared, and we were able to ask him to join us on the Spectrum News, which is who does a Capital Tonight, and he and Erica really talked about the business connection and that economic impact of businesses, and really focused again on the small business, that small businesses can't afford to pay for health insurance if they don't so that we were able to keep tying those messages in. We have all of our pillars of all the areas where we tackled business communities on our website too, under the About Me and the Business Councils. You can see that, and I can also share some of the work that Meg Malloy did in the business community. Okay.
Yeah, outside of the business community, the organizations like the AFL-CIO and Fairs of Breach Repairs, Moving Gardner, do they have impact on this?
In some of those areas, we've kind of worked in tandem. They haven't been part of our coalition, but in addition to Care for Carolina, the Justice Center was working with more groups like that, the AFL-CIO, other groups that, and we've kind of been working side by side and connecting, but they haven't really been a part of Care for Carolina Coalition. Okay. Yes, sorry.
Your organizational members, what proportion are statewide and what proportion are regional or local?
I don't know the answer to that question, but I will look at it. I will start doing it. I mean, primarily we are statewide, but we have really started, because of the regional outreach, started focusing on trying to build up individual communities.
And are they a mix of, are there faith communities, churches and so
Yes.
forth that are members?
Yes.
Are there local chambers?
The chambers have not, the NC East Alliance, I believe, did join. The chambers would have not joined. They did, but they did do that. We were able to start having conversations in the last year with them, so they would endorse the expansion, not necessarily. It's probably something that'll be part of my to-do list, to see if we could get the chambers to join.
I'm curious about the size of the budget that you needed to do that. Are you working with $1 million? Or more?
No.
$1 million?
No, about probably closer to $500,000. That is it. Again, it's like every year it gets extended, and I came in my transition in the past 2 weeks to this new role, and I was like, where is the budget? And they're like, well, this is the grant that we got for this work, and this is the grant we got for this work. And so not a universal budget, but that is actually on my to-do list. Maybe I should add that to my lessons learned.
Well, first off, thank you. The history of how it arrived to where it is today was really important. It offered almost a game plan in regards to how this happened there. It sounded very logical. But I remember reading an article in the newspaper where the hospital association there was the holdback. And I was surprised. And so can you give us some insight in regards to why the hospital association was so hard to get there?
The hospitals will have in North Carolina, and maybe even prior to the pandemic in North Carolina, have really taken it on the chin they've had a number of issues that just have kept them. And I think similar to here, that they were told that if you come out and so if Medicaid expansion is your number one item, then you're not going to get anything else. And they needed so many other things that Medicaid expansion was further down on the list for them for a number of years. This year, the Hospital Association came out in full swing and has been working with us. However, and there's some politics which I would happily talk about offline, but the extraneous pieces of the pieces are certificate of need laws and advanced practice licensing. And so they had to really work with their membership because all of them needed something different within the certificate of need laws. But they all want and need this hospital assessment program that's going to allow them to draw down additional federal dollars. So they are coming back and they've made that they've made their proposal. And so we do believe that the hospital association is going to start taking the lead on expansion again. But it's taking a while.
Yeah, so now that you guys kind of started to reach what the sort of end goal was with the expansion of the site, like where do you go from there? You know, what's sort of the plan to keep volunteers and donors sustained?
Right. I mean, our only mission has been to close the coverage gap, North Carolina solution, but it is something that we're thinking about, and why I am continuing to do a lot of outreach to new organizations, really maybe even focus, like you suggest, on local regional organizations, because this campaign would be for naught if we don't get people enrolled and we don't get them access to healthcare. And so I just believe that we need to continue to do that outreach so that when it does reach, then we do have passage that we can turn Carolina, Care for Carolina's coalition into a big education and enrollment effort. And if that means that the dollars follow us, or somebody else takes that over with additional dollars, I think we'd all be happy for that, and we'll go fight another campaign.
Great. Well, I know you all will join me in thanking Abby. That was really helpful. I feel really re-energized. I don't know about the rest of you, but it's kind of cool, right? So that is the conclusion here. Hopefully, if you needed CEUs, you've signed the paper. If not, Judy has it, or somebody has it. Okay, there it is. Very good, very good. Please go ahead and fill out this session on your evaluation form. Really appreciate that. Do all of your sessions. Get ready to submit that at the very end of the day, please. And I think that we are adjourned from this meeting. Thank you.